Well, a lot of people stressing out about the coronavirus, and it's taking a toll on our physical bodies. Dr. Jennifer Caudle joins us now. Hi, Dr. Jen.
Hey, how are you guys?
Let's get into some body
Good
parts
morning.
here, because I was reading this article that says a lot of people are grinding their teeth. And this has gone on forever when you're under stress. But teeth grinding, have you heard about this? Teeth grinding, have you heard about this? Knew about it?
Absolutely. So, well, I'm a family doctor, so I'm not a dentist. However, I have to say that there are lots of reports of dentists reporting increases in cracked teeth, very likely due to grinding and clenching the jaw, often due to stress. And I have to tell you guys, I have a family member of my own who actually recently had a cracked tooth. He's had really healthy, good dentition all these years. We think it might be due to the stress. So like clenching and grinding the jaw. This is one where our dentists are so important because remember, teeth cracking can be due to a number of things, not just from grinding your teeth due to stress. So you want to make sure you get a proper diagnosis. Our dentists are our best friends when it certainly comes to this. But yeah, there have been reports of increased teeth cracking.
Yeah, and it normally happens at night. Sometimes dentists will recommend a tooth guard, right?
Sometimes they'll do that. And of course,
Okay.
it's getting to the underlying cause. That's really what
Yeah.
the issue is finding what that is.
All right, the next stress issue that people are dealing with, neck and back pain, which also probably is compounded by the fact that a lot of people working from home, leaning over computers.
Zooming.
Yes, exactly. As a family doctor, I'm in the office right now. I'm going to run and see patients right after we finish this. But I've seen a lot of this: back pain, neck pain, muscle spasms, sort of tightness in the back of the neck. And, a lot of people, when it comes to stress, do carry their stress in the neck or in the upper shoulders, or in the lower back. But you're right, Alex. I do think that zooming and sort of working from home, maybe sitting all day long and maybe at home, maybe we don't have the best either posture or best equipment or chairs or things like that to help us. I say some of the best things we can do is making sure that we are doing stretches, that we are stretching out our neck, that we are stretching out our back and things like that. Also using good posture when we're sitting at home, getting good equipment, a good chair with proper support and things of that nature. But, I always say don't assume your back or neck pain is, what you think it is. Make sure you have a proper diagnosis about that. Sometimes you might need medications, et cetera, but stretches can be awesome.
Is there any way to reduce blood pressure on our own without medication? Can you meditate it away?
Yeah, well, so blood pressure can certainly be, increase in blood pressure can happen when we are stressed and things of that nature. That is possible for many people. So one thing I want to say for those of you out there with blood pressure and your blood pressure goes high with stress, minimize that stress, whether you need to be on social media less or on the news less, et cetera. But to your point, Mike, yes, there are things we can do. A little bit of weight loss, especially if you are overweight, obese, or morbidly obese, weight loss can do the trick. Not adding salt to our foods or eating low salt foods. And remember, the foods with salt are not just the ones we add salt to, because a lot of people don't use that salt shaker.
Right.
A lot of times it's foods that are processed and packaged and things like that, so be careful. And then exercising can help lower the blood pressure. So those are things we can do naturally, but you want to also make sure you minimize stress. And of course, see your doctor for blood pressure checkups.
Trouble sleeping. I'm sure a lot of people, their worries have been keeping them up.
Absolutely. Actually, this is something I've struggled with during the whole pandemic. I really am having some trouble sleeping. My sleep pattern's literally all over the place. If you feel like that's you, there's a number of things we recommend. It's called sleep hygiene, this idea of making our environment conducive to sleep. First thing is make sure your room is super dark, okay? Don't have light kind of seeping in because that could keep us awake. And keep that bedroom nice and cool. Actually sleeping with the bedroom in the 60s, 60 degrees area, and not 60, but in the 60s is wise. I actually sleep with it at 68. Make sure that you're not drinking alcohol before bedtime or exercising late at night or eating a big meal right before bed. Those are things that can disrupt your sleep. And then use your bedroom for relaxing activities. So not paying bills and doing crazy things that get you all riled up.
Well, we have to make that whole other topic is we're talking about physical health, mental health.
Yeah. Yes. Mental health is everything. I'll just make a quick statement about this. Anxiety symptoms, depression symptoms, PTSD. So many of us are experiencing any or all of that. This is really time to not only find the meditation, and we were talking about that a little bit. There are apps to help you meditate and relax. Cut back on social media, but talk to your doctor because there are things we can do, and talking to someone else can really help. So don't forget that.
All right, I'll call you after the show. Thanks, Doc.
Always good to see you, Dr. Jen.
Good to see you too.